The LGBTQ plus community is resilient. Many of us, including myself, have had to overcome many struggles and obstacles on our journeys to authenticity. There are societal obstacles, family obstacles, internal struggles, and medical struggles. Finding a qualified healthcare professional can be a daunting task. Jess Wisocky, healthcare provider and founder of Pathway to Better Health, has made it her goal to make appropriate healthcare a little less daunting for us. Pathway to Better Health is welcoming to all LGBTQ plus individuals. At the core of their approach lies a deep commitment to patient empowerment and autonomy. After hearing about her work, I wanted to sit down with her to learn more. I feel ever so grateful that you are helping us in these times. So I want to acknowledge right now that our community is forever grateful for people like you that step out into the world and say, come, let me help you. And so thank you for that. And I guess one of the first things I want to know is, because there's so few people that are out there that are helping our community, it feels like, what drew you towards helping our community in the first place?
Well, first of all, thank you so much for having me on the program. I'm excited to be here, delighted to be here. For me, I became a nurse practitioner in 2013, and I really started my career caring for marginalized and underserved communities. And it was just, it's sort of a natural progression over time. I started out in liver disease and hepatology, and at the time there was a lot of viral hepatitis, which overlapped with infectious disease. And eventually I left hepatology because it was very paternalistic, and I went to the infectious disease department in the hospital I worked at, which is more of a welcoming, sort of harm reduction focused practice, more sort of shared decision making with patients. And part of being in infectious disease was I had an HIV panel, and many folks in that HIV panel were LGBTQ identifying. And that's kind of where I really got my footing caring for the queer community. From my HIV practice, I ended up realizing that there's a tremendous need for gender affirming hormone providers in the community, and not a lot of people doing the prescribing. So I went out and I learned how to do that prescribing through continuing medical education and conferences, and added that to my repertoire. And from there, it's really kind of expanded into caring for people as best I can that are part of the queer community under one roof, so folks don't have to get their care kind of all around the state.
That is huge, because I've got a story about just this past year. My endocrinologist that I'd been working with for close to 2 years just came in one day while she was treating me, and she said, Kelly, I don't feel comfortable working with trans patients anymore.
Oh.
And she said, you're going to have to go find a new provider for your hormones, your endocrinology.
Wow.
And I'm like, yikes, because you don't expect that. You go to this doctor you've been going to, and they seem like they're very comfortable with you and everything. And she explained to me, Jess, that the reason she didn't feel comfortable was she had another trans patient that was getting massive migraines. Mm-hmm. And she wasn't able, excuse me, she wasn't able to control those migraines it was a trans man, mm-hmm. and she wasn't able to help this trans man overcome these migraines and prescribe testosterone. So instead of, wow, my voice is,
yeah,
it's very pretty. It's allergies, and it's also a tough story. Mm. But she said, you've got to go find somebody else, because I don't know how to help this one patient. Therefore, I'm not going to help any of you.
Wow.
And you were just saying that you went and got that training.
Yeah.
She could have done that. That's how I personally feel about it. She could have gone and got that training. If she knew she was going to work with us, she could have done it. And this was a large hospital facility. This was a large institution. And I was sent out on my own to go search. And sadly, I didn't know you at the time, because you would have been the first person I would have come to immediately to work with you, but I did finally, after banging on a lot of doors and going through a lot of hoops and everything like that, I did finally find a provider. But that was very traumatic for me, and I often wonder, why didn't she just go do that? So thank you for taking that step of going to learn how to help us more, instead of just saying, that's a community that I don't care about. I think you were talking about all of the different queer and LGBTQIA plus people that come to you. Who all are some of you? Can you give us just an idea of what kind of patients do you work with?
Yeah, so I had left a large academic medical practice to start my own small private practice, and so a large number of predominantly HIV positive folks or guys that were on PrEP followed me into my private practice.
Okay.
So I have a large cohort of men who have sex with men that I take care of, and then gender affirming hormone care is really hard to get up here in the Merrimack Valley, and like you had said earlier, the queer community really takes care of their own, right? And so folks will take you under their wing, and they'll start like pointing you in the direction of queer friendly providers. And so that has really exploded in my practice. It's like a few folks from the community needed hormones, and then people start talking and they realize you're there. So the gender affirming hormone side of the practice has like quadrupled probably in the last 4 or 5 months. And then I have a harm reduction background and addiction medicine as well, training. So there's a large subset of folks that I take care of that have both, substance use disorder and are part of the queer community. And then separately, I end up taking care of a lot of the unhoused community in Lowell specifically. So whether it's infectious disease needs or substance use disorder treatment for those folks, everybody really knows like they can come knock on the door and I'll open it and take care of them, and it's very much stigma-free, harm reduction mentality, meet you where you're at kind of a thing.
I'm glad that you were mentioning, people will come with substance abuse problems, because when I come to my doctor, I'm far more than just a trans patient. I'm also someone that's had major back surgery. I'm someone that has other health problems. I'm someone that also needs all of these other things taken care of. So I don't just come to you as a trans person. And it sounds like you're meeting these people, like you said, exactly where they are, and you're providing that service. And as the audience knows, I abused substances back in my past. Before I affirmed my authentic self, I self-medicated to deal with that. And then all of a sudden, lo and behold, I started affirming my authentic self, and I managed to stop all of those substances. And it's forever been in the back of my mind that I tell people, had I not affirmed my authentic self, I don't think I would have stopped those substances, because I wasn't willing to face the world any other way other than under the influence of drugs because of who I am. So the fact that you're meeting us in all of our different needs is huge for our community, because being under one house and not having to go to find this doctor that cares for me versus this doctor that cares for me is huge. So thank you, for real. Thank you for that.
Yeah, no, it's really, it's a real privilege, to be honest. Being able to identify needs in your community and then having the ability to go out and get the skill set to provide that care. Like, the reason I started doing addiction medicine was because in 2018, there was a big HIV outbreak in our community. So Lowell, Lawrence, Nashua, and Manchester, New Hampshire had, just this explosion of HIV positive cases in the people with IV drug use community. And this sort of just kind of brewed under the public health nose for months before we connected the dots between the 4 communities. And I was getting a lot of young, newly diagnosed HIV positive patients into my HIV practice, but I couldn't keep them engaged in care. And normally that's not a problem for me. Like, my patients meet me, usually they feel me out for a session or 2, and then after that, like, they're pretty consistent. They come in, they know what they can depend on me for, and that I'm just there to kind of meet them where they're at. The younger crowd that was newly diagnosed was really hard to keep them engaged because they would start out on Suboxone in clinics, and then they would get discharged from the clinic for not following very strict rules, or they couldn't maintain the methadone appointments to stay on methadone. And we were just losing folks in care. And so I had gone to the chief of the department and asked, why aren't we providing Suboxone for our patients here? They're doing great on HIV meds while they're on Suboxone, and then we can't keep them engaged when they get kicked out of the Suboxone clinic. And I ended up taking a night job so I could train under an addiction medicine doc in a detox setting to learn how to do it and bring it into my practice. And I'm incredibly grateful that it's a skill set I sought out to get, because at that time, you needed a special X waiver on your DEA license. There was, this tremendous burden of continuing medical education that you had to acquire in order to get the right or the privilege to be able to prescribe Suboxone to folks. They have since done away with that because they realized putting barriers in front of providers to address such a public health crisis was a bad idea. But I mean, it took hours and hours and a lot of training, and I did it. And it's one of the most gratifying things when you can connect with somebody who feels like they're not treated well by the medical system historically, but this is like a place they can come and be really honest about what they're doing, and you're never going to turn your back on them. You can come get your Suboxone, and if there's a slip up or you're not ready to quit meth yet, but you want to stop opiates, that's okay too. I just need to know what you're doing so I can keep you alive, keep you healthy, and lower your risk of getting any infections while we're doing it.
You're meeting us where we're at.
That's the goal, yeah.
Wow, that's so impressive. And you said 2018 was when this was happening.
Yeah.
People in their minds think, oh, HIV/AIDS, that's from the late 80s, early 90s.
Yeah.
They forget that this is still very much an active infectious disease that's in our community, and in all of the community, not just the queer community.
Oh yeah, for sure. I mean, the opiate epidemic really kind of changed, I think, the trajectory of HIV infections here in the country. And for a long time, people were saying the IV drug use community was one of the communities that were going to have a low barrier of entry for HIV. And we saw it in a city in Indiana first, where there was this big, huge outbreak, and it was, a public health case study essentially. And then just a few years later, I'm at conferences with Lowell, Massachusetts underneath my name, on my name tag, and we are the center of that conversation now. We didn't learn any of the lessons from what, the public health officials had described in Indiana. And we had our own big IV drug use community here with no way to get access to clean needles, a bunch of providers that either didn't have the expertise in prescribing Suboxone or didn't want to go get that expertise, and we were just othering those people as a community instead of taking care of them. So we made great inroads, I think, in the interim years, but I'm now seeing, budget cuts and programs closing or not being able to fully staff their positions, and we're losing some of the ground already in Lowell that we had gained over the last few years in that realm.
And so these budget cuts that you're talking about are through the NIH and places like that,
Yep,
which have a
funding.
direct impact on the ground for providers like yourself that are trying to help our community. And so now you're working with this population of people, that a very varied group of people, all kinds of different types of people. And I think that a lot of people don't realize is that the world of disease is always evolving too. I remember, was it in 2022 maybe, that we had the monkeypox outbreak in the area?
Yep.
And were you involved with that? Not directly or indirectly, or was that part of something that you were also working to help our community with?
Yep, yeah. When the monkeypox outbreak happened, it was a real full-on mobilization to get testing sites in place.
Right.
Which was its own sort of logistical challenge, because we had just sort of dealt with the brunt of COVID. So I had also been, I couldn't wear an N95 during COVID. I was in this like PAPR machine. I look like a astronaut. And so it's like this big machine that I have to wear, and this hooded thing so I don't get COVID. And I was doing monoclonal antibodies for COVID at the time in Lawrence, which, you know, was important because Hispanic communities were hit really hard with COVID. And it wasn't easy to get monoclonal antibodies. So I ran a clinic where we were able to make that happen in the community. And then it was like we had just shut down that monoclonal antibody clinic, and like 2 months later, this thing called monkeypox pops up, and I had to go drag out that PAPR again and put it on. And, you know, we weren't fully sure of how easy it was to transmit. Like, was I at risk as a provider by doing the testing and the treatment? You know, was the PAPR really necessary? Like, these were things we weren't totally sure of at the time, but you know, you kind of go in and you set up shop because it's your community, it's the queer community that really needed the care at the time. Right. And so there was a medication that was not FDA approved for this. It wasn't like available at a pharmacy, and for the most part, it was really being housed in Boston in the big academic medical centers. Okay. And it's hard for people to get down there from here, especially if you have monkeypox. Like, you're supposed to be quarantined, you can't be riding public transit down there. So how are we going to get folks up here that treatment? And so I literally worked every contact I had in my decade career, you know, dealing with DPH, groveling, like, how do I get this medicine for my community? And it was funny, like, I ended up getting an email back I was like, I have 5 people here that have it. How do I get it? And finally that email must have hit the right person, because they were like, we have it. It's on our campus in Tewksbury. Come get it. And it was really funny. I'm like driving a Mini Cooper through the Tewksbury State campus trying to find the pharmacy that has it, and getting lost on the campus. And then I get in there, and it's like almost like a code word when you're knocking on the door to get it. And it's like a little white bag. And that's all they gave it to me in. And I drove it back to the hospital I was working at, and I was like, this is like gold right now. You know, it's so hard to get, and we have it here in Lawrence, and we're going to take care of like the queer community up here that has monkeypox right now. So it was really just not taking no for an answer to get that up here, sidestepping big organizations and their policies and procedures, and doing like, you know, personal one-on-one contacts that I had through DPH to get it here. So it was great. That's
You're so inspiring. I'm just going to say, every time you tell me you're just so inspiring. You really and truly are. And what you're doing, it's just the whole world. You all need to just stand up right now and thank her, because really and truly, Jess, it's so, you're saving lives. You want to save lives. You're going out of your way to save lives. Like, you're driving your car through a campus getting lost to pick up a medicine that someone in Lawrence is going to be taking, that's going to change their life and heal them, cure them. Yeah. And that's a dedication that I wish all of our healthcare professionals offered. I understand that a lot of people see our community very differently than the way you see our community. And I think that's one of the reasons that people, especially myself being a transgender woman, anytime I have to go find a new doctor, it's terrifying, because you don't know. When my doctor that I worked with told me, you know, I don't want to see you anymore because I don't know how to help this trans person, therefore I don't feel comfortable helping you, that's a blow to your psyche, that's a blow to your ego. And the trans community in particular, whenever we finally broach the subject with our healthcare providers, I almost feel like our healthcare providers think this is out of nowhere all of a sudden, and they don't realize that before a trans person ever comes to them, this has been something that's been permeating through their soul, that's been permeating through their body. It's their self-identity that they've been working on, and this is not just a spur-of-the-moment decision like, oh, I want to now be on hormones, or now I want to socially transition. And for trans people in particular, which I kind of want to switch to for just a second, when I went to my doctor way back in 1995 to affirm my authentic self and get put on hormones, they put me on Premarin. Premarin made me doolally. I don't know if that's a medical word or not. Probably not. One of my students prefers the word wackadoodle. It made me wackadoodle. I cried way too much. I was very much too emotional. And I don't even know that my healthcare provider knew that there might be other alternatives, the oral pathways, so they switched me over to the injections. And for a year, I affirmed my authentic self. I was living as my authentic self. And then I started losing my job. I lost my family. I lost my way in life. So I actually detransitioned.
Okay.
And so from 95 to 2003, I went back to pretending that I was a man. I don't think I did it very effectively because I never was a man, but I pretended as hard as I could because I'm like, if I just try hard enough, this time I will stay a man. And of course, that's not how being transgender works. It's like myself. It's like in my soul, it's who I am.
Yeah.
So when a person comes to you now, I'm assuming from 1995 what a doctor knew versus 2025 what a doctor knows about it there has to be studies that have been done, I'm hoping. There has to be studies on what the impacts of the medicines. Like, I don't know what happened to me when I just cold turkey quit taking Premarin. Don't have a clue what that did to my body.
Yeah.
But what can a trans person expect when they come to you and they've made the decision that, okay, I want to medically transition? Are there steps that the federal government still has in place that you as a provider have to follow?
So, I mean, I wish I could sit here and tell you that I have, just troves and troves of research studies and data that I could tell you has been completed between 95 and today, right? But like, we've made some progress, I think, in that field. But I often tell my patients, medicine is both, it's a science and an art form. And sometimes with gender affirming hormones, it's more of an art form. We definitely are not using Premarin as a, first line for gender affirming hormone treatment anymore. But we don't have a ton of, double-blinded clinical studies looking at these things. So, I mean, there's different models that providers practice in for hormones. I practice in an informed consent model. So it's, we have a conversation, myself and the patient, figure out, what their history looks like of, deciding what is my authentic self, to them as the patient. What does that look like today? What did it look like before? And what does it look like tomorrow?
Okay.
And then one of the main requirements is that you would generally need to have a diagnosis of gender dysphoria. I mean, ideally, that's what you would kind of hash out of a conversation with the patient. You assess for that, and if that is there, then you're within the realm to be able to prescribe gender affirming hormones. You're not necessarily forced, through an informed consent model to have to go see a psychiatrist or a therapist.
Okay.
There are still some models out there that utilize that or require it before they'll prescribe hormones. But I have more of a liberal practice, and I don't do that. I, did some work and training at the MGH Trans Clinic. They don't use that model. They do informed consent along with me. So I think there's more and more providers moving toward the informed consent model. But it's not, aside from long waits to get in for consultation for a provider that does hormones, it's not as restrictive anymore.
Okay.
But there are long waits, especially at the bigger academic medical centers. It could be a 1 to 2 year wait for a consultation. And then the hormones is just sort of like one part of it. If somebody wants gender affirming surgeries, there are requirements for that. And so depending on the program the patient wants to have the surgery at, the program might even have more stringent requirements than what the WPATH guidelines say we should be doing, or even what the insurance company says is necessary.
Gotcha.
So individually, we have to really understand what what each program in the state is requiring for folks before I refer them. Because some, they do need letters from mental health providers, or they have to be on hormones for at least a year before they'll even see them, which is also kind of like a tricky thing. It's like, if I'm thinking about having a surgery, the fact that I can't even go speak to the surgeon in a consultation without having this whole array of other things that are required, it's almost nonsensical.
Yep.
Because at the end of it, I might actually not even want that surgery after I hear what you're going to tell me the risks are of that surgery and what the recovery looks like. But I don't even get to have that conversation with you as a consumer or as a patient until I've jumped through all these other hoops.
There were so many hoops I had to jump through to affirm my authentic self. For top surgery, like I went to Canada for my reconstructive surgeries, and I had to have a therapist, psychiatrist. They couldn't just be a psychologist. They had to be a true psychiatrist. And those things are all money.
Yeah.
So I tell people that I could have put down a down payment on a home, or possibly even bought a home, because when I affirmed my authentic self, there was no insurance coverage whatsoever for people. And there's probably still not in Tennessee, hardly, would be my guess, or maybe it's better now, but it was all out of pocket. So if I wanted to go when I wanted to have my reconstructive surgery, I had to go to Canada with a check to give them that was a cashier's check from the United States and hand it to them. And I just remember how fortunate I was that I was able to accomplish that.
Yeah.
Because any number of things could have derailed that whole process for me. And it just, taking care of yourself shouldn't be difficult. If you want to have that surgery, or you think you want to have that surgery, the ability to speak with a surgeon who can be like, okay, look, this is what's going to happen. This is some of the complications. This is what the final result is going to be like. At least you know that, and then you could possibly go do the other hoops. But yeah, I'm very fortunate that I found a path. Like I knock on wood every day, because I know so many of my sisters and brothers that they want surgeries, but they don't have the finances. They don't have the ability to go to the correct psychiatrist. They don't have the courage to possibly go get beat down by some random psychiatrist because they don't say the right words that psychiatrist wants to hear. And it does. It's sad that so many people just want to be authentic, and it's such a challenge to do that.
Yeah. Yeah. I mean, there's a lot of hurdles in the way, a lot of obstacles. You know, I often look to parity, right? And it's just like, are we making cisgendered women who want breast surgery get a therapist before they do it, and go through these sessions and have them write a letter for it? Like, it just, there is still a lot of, I think, stigma within the medical system, even though it's 2025. You can come across it in places you least expect it. And me being on the inside of the system, I see it all the time. And so I always take extreme caution when I have to refer my patients out, because I want to make sure I'm sending them to somebody who's safe. Like you had spoken earlier about, every time you have to go meet a new provider, it's that sort of hold your breath moment about, is this a safe space? Can I divulge, what's going on? Will they continue to give me care? And will that care actually be in the best interest of myself, or will it be covered in prejudiced thoughts?
Yep.
And we don't wear, I mean, some of us wear pins, right? That's, have the flag to signal that we're allies, but most of us that carry prejudice don't wear that pin, right? It's something that lurks beneath. And that's a scary, vulnerable place to be as a patient.
especially as from a marginalized community. And I know we've been talking about the hurdles and the difficulties of finding affirming care, and you're obviously trying to push some of those hurdles to the side and say, here's the door, step through, I'm here, and then I see you as a big, warm, fuzzy hug for us. You're like, I'm going to take care of you. I'm going to make sure that you're healthy. Bring your full self to me. Mm-hmm. Like, I'm not so sure that I feel comfortable divulging everything about myself to this day with this new doctor that I have.
Yeah.
Because I've not built a rapport with this doctor yet. It takes time to build it and for the doctors to listen to us and to hear what we're saying. Mm-hmm. But I imagine in all of these people that have come to you, there have to be moments when you're like, yes, or as one of my students says, yes. Yeah. And so there has to be those moments of joy that do come through every once in a while. And I was wondering, do you have any of those? And this might be too much, like all of a sudden, here, tell me a joyous story. But
yeah,
do you have any memories of things where you're like, yes, this is what I'm here for?
Yeah, I mean, this is like, it's hard work, right? And it's long hours, and it's grueling work sometimes emotionally. But it's those wins, right? Those little wins that I can carry with me that kind of give me the energy to keep going. And I find those wins and I savor them every chance I can, because they're just so important to, knowing like you're having a positive impact on folks. Yeah, I mean, I really connect with a lot of my patients in very fundamental ways. And, I treat everybody the way I would want my mom to be treated by a healthcare provider. Like, everybody I take care of is somebody's son or somebody's dad or somebody's brother or somebody's mom, right? And so they're loved by somebody, and that brings value. And so, I do take care of, I think, some of the hardest demographics of people, right? Like folks that are unhoused, folks that are substance using. And they know I'm always going to be there. But if they walk through the door that one day and that's the day they want Suboxone, then that's going to be the day we go to Suboxone as a treatment option. And so I had been taking care of one individual for many years who was HIV positive and also was actively using. And he would never take the medicine that we prescribed. He was still using, didn't really want to engage in Suboxone, but like always still came to the appointments regardless. So at some point it just kind of became, we were just checking in on each other and having conversation. The focus shifted away from, why aren't you taking your ART? Like, your viral load is detectable and you're getting AIDS range CD4 count. Because like nobody wants to be talked at, right?
Right.
So, after years of this rapport, I eventually left the organization that I had started out seeing this person at, and to my surprise, like 4 months into my new place, they showed up. And I was like, this is so interesting. Like, what are you doing here? Like, I'm going wherever you're going, is kind of what they said. And so we kept doing our thing, meeting every so often, and just checking in on each other. And then one day they showed up with their daughter. And I was like, are we allowed to speak freely right now, right? Because not everybody knows, about somebody's HIV status, even though they're at the doctor's appointment. Sometimes I have to really tiptoe around that stuff. And so he says, yeah, you can speak freely about it. And so, the first question I asked is, what are you thinking about trying Suboxone? And the daughter looked at him and goes, Dad, I think it's time. I think it's time you should do it. You should let her do it. And so in that visit, I got an agreement to go on Suboxone. And in that same visit, I said, hey, there's these new medications for HIV that are injectables. And you have a strain of HIV where I don't think I could control it with one injection, but there's this new injection that's subcutaneous, that's every 6 months, that I think paired together, I could get you on HIV treatment that doesn't involve you having to take those pills, because I know you don't feel good when you take the pills. would you be willing to try it? It's off-label use, but I think we could make it work. And so in that visit, in addition to Suboxone, he agreed to go on these long-acting injectables. And it was hard, like getting him fully off of the fentanyl and onto Suboxone. It took me a couple weeks. It took 3 a.m. phone calls from him sick. It took me being available on the weekends to get him through the withdrawals and onto comfort meds, but we did it. And he, you know, was sober for the first time in his life in decades and is undetectable for the first time in decades and has been undetectable for years now because of these, like, sort of, you know, these thinking out of the box ways of meeting people where they're at and willing to take risks. And I'll tell you, I also, like, I don't have all the answers myself, but when I'm not sure, I need a, you know, a second opinion of maybe somebody with more years of experience. In the world of HIV, there's hotlines we can call where we get other HIV experts and we can have conversations with our colleagues about difficult cases like this. I will also say in the world of gender-affirming hormone care, there is a hotline for that too. It's the trans line. Your endocrinologist could have called that line to get expert advice from, you know, somebody who's maybe been doing this longer or has just seen different cases that they could bounce off of each other to try something else. So it's the willingness also as a provider to, like, meet people where they're at, but then also go tap your colleagues who have been doing this and sort of getting, you know, a lot of different perspectives around the table to look at the case you're trying to help. So I don't know, for me, like, that's one of my happiest moments.
That's a huge one.
It is.
That's a huge one.
It is huge. I'm so happy that I could do it, and, you know, I still take care of him to this day, and yeah, it's been really wonderful. But there's moments like that. That's like a really big moment for me. Like, I'll take that memory to my grave. It's something I'll always look back and be really happy that I was able to be a part of. But, you know, even hormone consults, like I get a lot of 18-year-olds. Like, the moment they turn 18, they're scheduling an appointment in the clinic. And so in a state where you have access to hormones under the age of 18, that's usually like a signal to me that maybe there's something kind of going on in the home dynamic where they felt like they had to wait until they were 18 to come in. And so, you know, there's definitely been some times where an 18-year-old shows up and then the parent is also in tow. And you just really, as the provider, you never know exactly the dynamic you're setting foot into in that exam room. And recently there was a case where the 18-year-old was, like, very adamant, like, this is what I want. I've been thinking about this for years. I know this is who I am. And the mom was very nervous about it, I think. And the patient was looking at that more of like, you don't want me to do this. And I think the mom was very nervous, like, the world is going to see you in a different way now, and that could be dangerous for you. And then I'm sort of sitting there in the middle of it, like, this kid already feels like, you know, they have to prove their transness to me to get the hormones, and they have to prove their transness to their mom right now to get the hormones. And it was getting really tense, and I just looked at the 18-year-old and I was like, you know, I'm going to give you the hormones if you want the hormones. Like, you're the patient, you're 18, you can make a decision on what to do with your body, and you don't have to, like, worry that I'm going to gatekeep it. We're going to have this conversation. I'm going to tell you about the risks and benefits. You can ask me any question you want. And at the end, if you still want it, I'm going to prescribe it. And that just took all of the anxiety out of the room. Like, instantly, the 18-year-old just sort of, you know, collapsed into themselves, started crying, and I think the mom saw how much that meant. She got up and went over and hugged the kid.
Oh my gosh.
And then the mom was like, you know what, you're right. Like, I have seen this in you for years. You know, and it was a really powerful, moving moment, and, you know, it was like a best case scenario you could hope for as a provider who's sitting between a mom and a youth. And it was also like a best case scenario you could see as a mom myself. Like, it's so important to support your kids and to love them unconditionally. And that unfolded like right in front of me in the exam room. It was a really powerful moment.
You have to just sometimes go, you must be exhausted quite often, but those moments like that, because you know that that's not the last moment that's going to happen on this journey for helping our community. And that child found you, that adult, 18-year-old adult, found you through their own networking, I'm assuming. I don't know if it, well, they're now very computer savvy, so my guess is that they found you through some sort of social media or something like that. But there's other people that are 50, 60, 70 that are like, okay, enough is enough. I have to affirm my authentic self at this point. And for those people, they have a community that's they've built based on this life over here. And now they're going to have this life here as their authentic self, and they're like, where am I going to get community? I don't want to be alone. I don't want to find out that I'm not welcome in certain spaces. How do people in the Lowell and the Merrimack Valley find community? Well, at all ages, but I'm particularly thinking because I know several older people my age and older that are transitioning now. So what are some ways that they can find community in this area to help them along with this journey also? Because you've got to have community.
No, I agree. And to be honest, finding the community was one of the things I really struggled with when I started the practice. Because it's like, if you know, right? Like if you know I'm there, you know I'm there. I don't have a budgeting ability. I don't have an advertising ability with a budget, right? So everything I do is through word of mouth. But back in the day, like you could just show up at a gay bar and there's community there, and you tell everybody who you are and what you're doing, and you know that you just opened a practice. People could go to the bar as a place to kind of convene and have sense of community, right? We don't really have those kinds of gathering spaces anymore, at least outside of Boston. In the Merrimack Valley, I don't really know of any authentically like gay bars up here, right? So where is the community hiding? And that was one of the things that I really struggled with as I started the practice, and word of mouth got out through the community I was there, so I was getting more and more patients through that. But those guys were all like, where is the community up here? Because a lot of them were driving into Boston, or they were on Grindr, and it was just kind of like hookup culture, right? But they wanted something more. And so, you know, realizing that, and also realizing there's a lot of, you know, knowledge deficit around medical stuff that would be more easily tackled in a group setting, I was like, you know, we should create the space for folks. And so part of creating that space was developing this thing called the Chroma Sessions, which are, you know, queer health series that are really just dedicated to creating safe space for people to come out, and, you know, folks can tell me the topics that they want education on, and I'll go find the experts to do it. And, you know, we break bread together, and we have time to kind of talk with community while we're there. And my hope was that as this thing sort of takes off, like folks will start to see similar faces at these things and then develop community outside of the Chroma Sessions. And that, you know, that's been what's happening in the last 5 to 6 months with Chroma Sessions. It's really taken off. We've covered topics, you know, we did a trans tape binding workshop, which was like hands-on stuff, really amazing. We did a Know Your Rights workshop, a gender name change clinic right before the new president took office, which was very fortunate timing to be hosting a name change, because shortly after that happened, it became very difficult to do gender and name change, you know, paperwork. And we also have done like healing therapy session, music therapy, art sessions, and, you know, some of them are heavier topics and some are lighter topics. But at the end of the day, like everybody who is there in community, and it's really blossomed. So yeah, for folks who want to get involved, we host Chroma Sessions. I try to do 1 session a month, and then we post those things to the Instagram page for the clinic. and I am actively working on a mailing list so we can set up, just maybe like a once a month email for folks that maybe aren't using the Meta platforms or are trying to move away from Facebook and Instagram.
Facebook. It's a double-edged sword for me.
Yeah.
It very much is. And I think community, for me, happened in queer sports of all places. And as a trans athlete, I would drive into Boston. It's funny you were mentioning Boston. I would go into Boston to play in their queer softball league. And I've met some lifelong friends there in that community that I still keep in touch with. They reach out to me on the regular, check in with me. I now live quite a ways from Boston, and as everybody knows, well, anybody that's ever been to Boston knows it's not easy to get around Boston. Like, you have to want to be in Boston to get around Boston. And so my community was sports. And right now there's a lot of pushback, and you might not know the answer because there's probably not any studies based on what I'm hearing you say. But there's so much pushback saying I, as an athlete, have an unfair competitive advantage as a trans woman, even though I get my butt handed to me all the time in sports, so I don't understand where that unfair advantage is coming from. Are there studies that you're aware of that I could put a link on this episode to where people could see, like, this is what happens to a person in sports, or this is what happens to the, in my case, I was assigned male at birth. What, physically, I know I'm weaker, but I like to tell people just that before I affirmed my authentic self, I've been playing the sport of disc golf now since 1991. Back when I was presenting as male, had no estrogen in me, had no affirming, nothing, like I was totally hiding it from the world. I stunk at the sport of disc golf. Like, had all of these advantages that they say that I should ever have. As soon as I affirmed my authentic self, as soon as I started feeling joy and happiness in myself, I started playing my sports better.
Yeah.
And based on what I hear all of these people saying about us having an unfair advantage, well, if that's the case, then every male athlete out there should start taking estrogen because it made me a better athlete. So, I don't know that that would work for them, but it certainly worked for me. My 60-year-old self now would destroy my 30-year-old self that was male 100% presenting, had nothing taken out of me. So I guess, is there any data? And I don't even think data matters to some of these people. They just want to hate on our community for the sake of hating on our community. But is there any data out there? Like, let's say I wanted to go to my legislator and say, look, you cannot ban me from sports. Here's proof that I don't have a competitive advantage.
I think it's a good question. I mean, I have heard people making the argument that folks, so like trans woman, for example, has their hormone level range ideally within the same range as a cisgendered woman for estrogen. And then with that usually means a testosterone level is less than 50, which is, on par for, I mean, we all cisgendered women have some level of testosterone, and every cisgendered male has some level of estrogen. Like, we exist with both these hormones in our body. But, there's some argument that says, well, cisgendered trans woman to be able to compete would need to have hormone levels for a year that are within range of a cisgendered woman's cycle, essentially. I honestly haven't seen the studies where people are looking at it. It's possible they're out there. I could try and find some and connect you to them, but I think you're right. It's one of those things where people are going to hate on it, no matter what you put in front of them, right? Like, you could literally be telling them the sky is blue and show it to them, and if they're going to want to tell you the sky is red, they're going to still tell it in the face of a blue sky. It's almost like it's a culture shift that needs to happen. And I think it's a hard sell for, I think, one, for, older generation, and two, for parents that might be heavily invested in kids' sports, to think like there's a trans kid participating on their kid's team. Honestly, I think the argument is more cultural than it is medical.
I agree.
Yeah.
I agree. And I want to keep playing sports. I actually have an event coming up this Sunday. I'm the defending champion at it. So I'm going to go try to defend my title at this tournament. But it's kind of funny, the very next tournament after that one last year, I came dead last.
Yeah.
So I'm winning and I'm losing, and that seems like how sports operate. You don't win them all, you don't lose them all, you just play.
Yeah. Well, and I think too, a lot of the, I think as like adults and as a society, I think we're also just kind of forgetting how important sports is to kids, right? Like for development reasons and social reasons, and, being involved in sports has always been a protective thing for kids.
Yep.
Like if you are in a socioeconomically depressed community, bringing sports in there is a protective thing to keep those kids out of trouble after school. Like, getting queer and trans kids involved in sports is protective. And I'm not surprised that when you play sports, you come out of it with lifelong friends. Like that's part of the camaraderie of sportsmanship. So, to be honest, very few kids are going to go on to be like professional NBA players or professional MLB players or Olympic swimmers. They're the minority that we're kind of, I think arguing over. The reality is, all kids should just be able to play sports.
Yep.
That's just, it's as a parent myself, as a community member, as somebody who has also worked in the schools, it just changes, kids for the positive, and we shouldn't be limiting or stipulating who can play and who can't, especially kids that are so vulnerable. Queer and trans kids, you're going to tell them you can't participate in something that is often like life-saving for kids and helps them build confidence and social connections. It doesn't make sense as adults that we're sort of forcing that onto our children.
I know a lot of trans youth that play sports. And I have one dear friend of mine, and her daughter, a trans girl, has tried out like 7 or 8 different sports. She's done fencing, she's done volleyball, she's tried softball. And the thing that she keeps coming to is what you said, she's made friends.
Yeah.
That's really, she has fun and she goes and hangs out with her friends.
Yep.
And you would think that that would be enough for the rest of the world.
Yeah.
But I'm going to keep playing sports. I hope that all the other people out there just go play sports or do whatever makes you feel comfortable and safe. It can be doing art, music, whatever. There's all kinds of options out there for it. But Jess, I guess I kind of wanted to start wrapping up with a couple of things. So you're talking about the Chroma sessions. The name of your company is Pathway to Better Health.
Yep.
And where do you see that heading in the future? Like, what do you see as a long-term mission for your clinic?
So the clinic is very much a community-rooted clinic. It's there because the community wanted it to be there. When I was leaving my academic medicine job, it was a cohort of patients that didn't know each other that kept showing up, telling me, Jess, it's time you hang your own shingle, like we'll help you. And it was, my patients found the office space. One of them got the exam table from eBay. Another one got like my sink from the Facebook Marketplace. I mean, they showed up, they were hanging curtains, moving furniture in. They were sitting with me in the beginning when I had new consults that I couldn't identify how they were referred to me. So they were like making sure I was safe as I ventured out and did this on my own. So it's a very community-rooted organization. And as a nurse practitioner, I take care of the whole person as best I can. And when I see that there are socioeconomic things that are making it harder for people to engage in care, it's really hard being connected to resources and not sharing that. So I'm not a trained social worker, but I end up doing a lot of social work through the clinic. And as the clinic grows and I'm still a solo provider, that becomes harder and harder for me to manage. So one of the things I started to do was we are working on a mutual aid platform for the community. I know who needs things in the community, and I also know who has those things in the community that they could give them. So I've become this hub of, helping people get things that they need. And so we're trying to formalize that now. So we started this coalition called Chroma Care Coalition. We call it C3 for short because it is a mouthful. But, a group of us sort of meet informally a couple times a month around my dining room table at my house. And we're just trying to figure out, when somebody's in crisis and needs housing, and if I'm not able to stop seeing patients and take care of that, we have somebody in the Chroma Coalition that we can kind of tag in to take that person to the, to CTI to complete the intake paperwork for housing. If there's folks that have some food insecurity, there's this thing called community servings if they meet the requirements that we can sign them up for. And so it's training folks within the community who want to be of service to the community how to do it. And now we're formalizing that with the C3 group that's coming up. And then part of that is we're trying to get a mutual aid board on our website. So folks can see, post what they need and then connect with folks who have what they need. And that is, also in honor of moving away from meta platforms where a lot of the community feels that Meta has made it very clear that they're not welcome there. And so trying to capture folks to keep a sense of community as we move away from social media platforms. So, that's another big thing that the clinic is working on now. I think ultimately the things that I have seen in the last year in particular is that we really need an LGBTQ center in Lowell. And, my hope is that with this momentum of folks that are participating in the Chroma sessions, folks that are showing up for community, and as we create these safe spaces, we're going to have the momentum to, come together hopefully with the city and be able to find space for an LGBTQ center.
Wow.
And, you could walk in there and get anything you needed as an LGBTQ person, whether it's you need somebody to help you with housing, you need food, you need STI screening, you need HIV treatment, you need help getting off crystal meth, whatever it is. Or my big dream for it is it also has a coffee shop in it. So, or you're just showing up to get a latte and nobody's none the wiser why you're there. And we have, a queer library in there, and it's a place kids can go after school and do homework, but it's also a place where if you're struggling with mental health, we can have you seen there and have you connected with folks who are queer competent, viewing the world through a queer lens to give you, mental health services. Wow. So I don't know, these are pipe dreams, and they're just in the beginning stages, but if you don't dream it, it's never going to happen. So we got to start somewhere, and there is absolute momentum in the community to make it happen right now. So even in these really hard times and these times where we're feeling we're being, stuffed into the cracks and we're trying to kind of hide to protect ourselves, community is showing up in really prominent ways, and as long as the community is showing up, I'm here with them, and hopefully we're going to build something really monumental during a time that is showing us is intended to be very oppressive of us.
I'm speechless because it's the dream that I had as a child, because I grew up during the AIDS epidemic. I was terrified to go to the gay bar.
Yep.
So I didn't go in there to get the community that I needed to get the information of who to go to. So I had to just bumble my way around, and finally I did find another trans person that guided me. And thank you, trans grandmother. She's
Yes.
passed away now, but she was kind of held my hand and said, "Come along, Kelly, we're going to help you grow up."
Yeah.
And it sounds like you're trying to create a community that has all of those people there to help us when we come into it. And I want to be a part of that. I'm not going to lie. I want to be a part.
Yeah.
You have inspired me to jump on board and help you any way I can with it, because I feel like it's a very noble cause. And I think the thing that struck me when you were telling this bit about your journey was people saying, "We've got you."
Yeah.
They helped you.
Yeah.
They went and found your needed requirements to create this clinic that is now out there helping people. And they were like, "We see this in you." And I hope you see it in yourself as well, because you have certainly earned the right to be seen by us. And I wish you nothing but the best on this journey, because there needs to be more people like you, Jess, in the world. And they need to step up for us, and they need to step up for you. Our community needs to step up for you as well. We need to be there for you and let you know that, hey, you've helped us, and we want to now pay it forward. And it sounds like that's speak it into reality is what's happening. But I am truly humbled and honored to have had you for a guest. You are really and truly an inspiring human being. You really are.
And thank you for having me. It's been lovely.
No problem at all. Anytime you ever want to sit down and talk with me, I'll just sit here and listen and be like, okay, keep going. But I do have one more thing.
Yeah.
Is there anything that you've ever thought, I've always wondered this, and I'm an open book. You can, if there's any questions you can think of, it's like, I've always wanted to ask a trans person this question. And I'm more than happy to answer it.
I think if there's one thing in particular that would have made things easier for you from the medical community, is there something there, or is it just too overarching, challenging to interact with the medical community as a whole, that it could just be one thing that would have made it better?
I think the one thing that would have made it better was listening skills. I wish that I was heard.
Yeah.
When I was a child and I would go to the doctor, I would tell them, I feel like I'm here, but I'm not here.
Mm-hmm.
I didn't have the words to say I'm a trans girl,
Right.
but I did say to them, I feel like I'm here, but I'm not here.
Yeah.
And they never
Explored
that. We never ventured down that pathway, even as a child. So I think listening skills and asking the questions, be brave. So for me, that would have been the one thing that I feel like would have helped me, was to feel like I was being heard.
Yeah. We need more curious providers. I mean, that's really like the curiosity to ask the question, right? And it's hard, like corporate medicine is a real thing right now, and healthcare providers are pinched from every aspect, how much time we get to spend with patients, and the overwhelming burden of the administrative duties that come with it, and the need to be charting, and typing instead of like looking at your patient and reading their facial expressions. Corporate medicine has, in a lot of ways really taken the human part out of healthcare. And providers are burnt out and they're tired, and the corporations need higher reimbursements to keep going and cover their overhead. And at the end of the day, the two groups that are hurt most are the patients and the healthcare providers. Most of us go into the field to help people, and we get so, I think, blindsided by all these other obligations and stresses. Like, we forget that there's somebody in front of us that probably waited months for that appointment and, gets like a 15-minute time slot. And you're supposed to unpack all these heavy things in that 15 minutes. And you realize you can't keep up with it. So you just stop digging, or you lose your curiosity at some point.
So as a patient, then, what would you like for me as a patient going to my doctor to keep in mind about my doctor and that is going on? And it sounds like I need to possibly show a little bit more empathy as a patient also, that they want to help me, but maybe the hurdles and the barriers in front of them are making it difficult for them?
It's hard. You know, I think as a, you know, as a person who's from a marginalized community, I would tell you, you should always trust your gut. If there's something in your gut that's telling you this is like not a safe person, or you're feeling like maybe you're being gaslit right now by your interaction, that's probably a real feeling, and you need to like seek care elsewhere.
Okay.
Because at the end of the day, you could be putting yourself in a really vulnerable position with a provider who is not open about this. And you know, we just did a Chroma session about the history of medical injustice for the queer community. And so part of that is like, we as healthcare providers are coming in off trainings from generations before us that were very much steeped in you know, a prejudiced way of viewing homosexuality and trans folks. And so how do you undo generations of that medical training? And I'll be honest, like from a nurse practitioner educational point of view, and you know, in medical schools, it's barely touched upon. So, you know, I always tell my patients, like, trust your gut. And
Okay.
I'll be honest, you know, opening up in little bits is probably safer, because I can't sit here and tell you that every provider is going to be as accepting as I am. And I, unfortunately, you know, even last week, one of my patients who's been with me a long time said to me, you know, I had to send him to a hernia surgeon, and he came out of it and called me, and he's like, Jess, it's been a long time since I've experienced stigma from a medical professional because I've been with you for so long. Mm. And he goes, and it just happened, and it took me off my feet. He's like, I'm really stunned, I'm angry, and I don't know what to do. And so I wish I could tell you, like, we're all open and we're empathetic and we're compassionate and we'll see you as the person you are. But I know it's not true.
Okay.
Trust your gut. Yeah.
I'm pretty good at that. I think
Yeah.
that's one of the reasons I navigated East Tennessee so well.
I bet.
But thank you for sharing so much with us, and those moments of joy that you have received and been a part of. Keep creating them.
Thank you.
mean,
I hope to. Yeah.
You will. You will. You've got empathy. You've got compassion. You have a great sense of humor. You've got all the things that we want to see in other people, no matter what their profession is. I'm a school teacher, but I want my students to see those things in me. Mm-hmm. And you've got it. So thank you so much, Jess. And everybody out there, take care of yourselves. And as you so wisely put, trust your gut on these things. I think that's some excellent advice. And go be as authentic and as healthy as you possibly can be. Bye.